Hi, Joan Johnson here from J. Johnson Education Center, and I'm going to be covering some skills today. We're going to look at denture care this morning. So first, I want to remind you to always read your skill sheets once you have seen the skill. Always acknowledge who you are, always acknowledge the resident, knock before entering into their room. And then once you go in and you do all those other things like acknowledging yourself and getting their name, then you want to explain what you are doing. So right now we're going to be doing denture care. I hand sanitize and I put on my gloves before handling the dentures. So one of the things that I'm going to do is I'm going to place a barrier in the sink here. You see that? That barrier is in the sink so that I can put the dentures and the denture cup on there, and I'm going to set the top up there. If you also notice, I have a barrier underneath my emesis basin and my toothbrush and my toothpaste because I'm going to sit that there. Now I'm going to turn on my water. I'm going to adjust my water. I don't want my water too hot or too cold because I don't want to injure the dentures, okay? Then I'm going to rinse my basin out. That's the first time I did the rinse. I'm going to take out my toothbrush. Never lay your toothbrush down because remember, this is cleaning their dentures and you don't want particles or anything on that. So then what I'm going to do is I'm going to open up my toothpaste. Now, there is no certain order in which these things have to be done. You just have to remember to do them, okay? So I'm going to wet my toothbrush, apply my toothpaste, take the denture out, whether it be a partial or whether it be a upper or lower, rinse it off. Then I'm going to brush all the surfaces. I'm going to hold my hands up so that you can see what I'm doing. But when you're doing dentures, you should be doing them over the cup with your hands lower because you don't want to drop them. And if you were to drop them, you don't want them to break. So now I'm rinsing them off and I'm putting them in the emesis basin. I'm going to rinse my toothbrush off, put a little toothpaste. Then I'm going to rinse off the other part of the dentures, whether they be upper or lower. And then I'm going to brush all surfaces. Again, I'm holding my hand up so that you can see what I'm doing as far as brushing. There is no certain amount of time that you have to brush. You just want to clean the dentures. And again, your hand should be lower in case you drop them. Now I'm going to rinse it off. Put it in the basin. I'm going to rinse off the toothbrush. Put it back in its container. I can close my top for that now. I'm going to pour the water out of the denture cup. Rinse this cup off. Then I'm going to put water back in here because you don't want the dentures to get dry. Then I'm going to rinse off my top before I put my top back on my cup. I'm going to take a paper towel, dry off this entire container, dispose of that. Then I'm going to take my emesis basin, dry it off after I rinse it out, because that's twice that I've actually rinsed that off, correct? Get rid of that. Now I can turn this off with my glove on because I still have on gloves. Then I'm going to take this because I'm still what? Putting things away. Always put things back where you got them from. So now here it is. I'm done with this. I'm getting rid of my liners. And then I can take my gloves off. And I can hand sanitize. Thanks for watching. See you soon.